Okay, let's talk about one of the most dangerous drug combinations out there. One that can turn a totally routine medication pass into a fatal error. We're going to break down exactly why sildenafil and nitrates must never be mixed. And trust me, getting this right isn't just about passing your exams, it's about saving a life.
You heard that right. Let me say it again, because it's the single most important thing you'll hear today. Mixing sildenafil with nitrates can kill your patient. There is zero gray area here. Absolutely none. And that's exactly why this isn't just some random pharmacology fact to memorize. Nope. This is a huge deal for patient safety and, you guessed it, a topic that comes up again and again on the NCLEX. Getting this wrong has serious consequences, both on your test and, way more importantly, in the real world with real patients.
So what are we actually dealing with here? Well, think of it like this. On one side, you have sildenafil. You probably know it as Viagra. And it works by, let's say, opening the floodgates to improve blood flow. Then on the other side, you have nitrates, like nitroglycerin, which do the exact same thing. The problem isn't what they do by themselves. It's the absolute catastrophe that happens when both of those floodgates are thrown wide open at the very same time.
Let's break it down a little more. You can see we're looking at two drugs used for very different things. Sildenafil, a PDE5 inhibitor, is often used for erectile dysfunction or pulmonary hypertension. And then you've got nitrates, which are go-to drugs for angina, chest pain. Both of these conditions are super common, which is exactly what makes this interaction so scary. The odds of one patient potentially needing both are actually pretty high.
So how does this whole thing turn deadly? Let's walk through what I call the dangerous domino effect. I promise, I'm going to make the pharmacology behind this super simple and crystal clear. Okay, the key term you absolutely have to understand is vasodilation. It sounds fancy, but it's really not. It just means the widening of your blood vessels. Think of it like a garden hose, suddenly getting wider. The water pressure inside would drop, right? It's the same in the body. When vessels widen, blood pressure goes down. And the critical piece of the puzzle is that both of these drugs cause this to happen. And this is where it all goes wrong. This slide shows that deadly cascade perfectly. So, step 1. A patient takes a nitrate for their chest pain. Their blood pressure drops a bit. No big deal. Step 2. But then they also take sildenafil. Their blood pressure drops even more. And that brings us to step 3, the result, a catastrophic, life-threatening hypotension. We're talking about a blood pressure drop so severe that the heart and brain can't get enough oxygen. This can lead to shock and, yes, even death. All right, let's switch gears and talk about the red flags, what you must spot, both for your exams and when you're at the bedside. Honestly, mastering these points is what separates a safe nurse from a dangerous one. Okay, these are your non-negotiables. First, and most importantly, sildenafil is an absolute contraindication for any patient taking nitrates. That means you never give it, no exceptions. The main adverse effect you're looking for is that sudden, severe drop in blood pressure. But for your exams, you also need to remember other key points, like counseling your patient to report priapism, that's an erection lasting more than 4 hours, because it's a medical emergency.
Look, if you walk away from this with only one piece of information, let it be this. This is the whole shebang. The entire reason we're talking about this is because sildenafil foam plus nitrates can and absolutely does lead to a fatal drop in blood pressure.
Now, knowing this stuff is one thing, but remembering it under the pressure of the NCLEX or in the middle of a chaotic clinical moment, that's a whole other story. So, let's lock this concept into your brain with a super simple memory trick. So how do you make sure this information sticks when you're in that high-pressure situation? When the clock is ticking and you need to make the right call fast? Here it is. Just remember this little phrase. The afils and the nitros will make your patient's pressure fall. Sildenafil plus nitroglycerin equals a pressure fall. Say it with me a couple of times. Afil and nitro make the pressure fall. I promise, if you burn that into your memory, you will not forget it. Okay. So now you get the concept. Now it's time to actually apply it. The only way to truly master this for your exams is to practice with NCLEX-style questions until picking the right answer becomes second nature. So, I've created a totally free quiz for you to lock in this knowledge. Go to nursingwithcharity.com.ng right now and test yourself. That's nursingwithcharity.com.ng. Go nail this topic, protect your patients, and ace your exam. You've got this.